So before we do, I just wanted to acknowledge that we are on the unceded territory of the Squamish, the Tsleil-Waututh, and the Musqueam peoples. And I wanted to thank them for having all of us here on their territory and welcoming us the way that they have done. Now, I want to read my first question. It's from Anthony. Now, he's from the West End Seniors Network, and this is a question. While the impact of COVID-19 on older adults in residential care is an incredibly important issue, equally important is the impact that this pandemic has had on the mental health of older adults attempting to stay safe at home. What steps are you taking and will you take to address this parallel crisis of older adults' mental health? There's a second person, just one more person, Jerome, added to this question by saying, what supports can the federal government improve on for implementing the support mental health for youth during the pandemic? So we have both ends of the spectrum, support for youth and support for seniors.
Yeah, it's such an important question. And I'm so glad that people are talking about mental health. And, we know, both of the Jerome and the other questioner both highlight what I think is becoming apparent to everyone, that the longer we're in this situation, the more people are suffering at all spectrums, whether we're talking about older people, oftentimes single or alone or living in long-term care, for example, or oftentimes separated from their normal activities of life. I think about the amount of young people too that are also struggling, right? This is disrupting school. This is disrupting their studies. This is disrupting what I always say is a critical part of their development, which is the need to socialize and the need to get to know themselves by socializing with others. So there's a few things. We knew early this was going to happen. We could sort of obviously go to the literature, but also just from what was happening around the world, and Canada, as you know, was watching what was happening in other countries. And so we rapidly stood up something called Wellness Together, which is an online portal. I wish more people knew about it. It's a free resource for every Canadian, every person that needs it. And you just have to go to wellnesstogether.ca. There's resources available in French and English. You can do a self-assessment. And I highly encourage everyone to do it. I have done it. Varies depending on the day, how well I'm doing. But not only that, you can get hooked up with actual paid professionals, psychiatrists, psychologists, social workers, a variety of different kinds of helping professionals at all different levels. And they're providing services virtually, by phone, by text. Obviously, oftentimes actually youth prefer to text. Lots of people prefer to text. And what I would just say is it's completely confidential and private too. So, it's a great tool for yourself. It's also a really great tool if you know other people that are struggling. We've all seen friends in our lives or family in our lives that are struggling with more substance use. More people are reporting they're drinking more, they're using more substances, they're eating more, they're falling sort of into habits of less healthy behavior, because obviously it's so much stress, and we as humans are programmed to try to make ourselves feel better. I use this because for me, I love to eat when I'm stressed out, and so there's obviously coping tools that can help. The other thing is we've been supporting provinces and territories in the area, for example, of substance use, to get more programming in place, whether it's safer supply and all kinds of other things to try and save lives for people with very problematic substance use. And we've also been funding a lot of the support help numbers, the suicide prevention numbers, the kids' help phones, those kinds of places that do amazing work day in, day out, all the violence prevention work, and the women's shelters and the women's violence prevention centers, because also that sadly is on the rise as people are stuck together. So those are the kinds of things we've been doing. But if I can leave your questioners with anything, it is wellnesstogether.ca. Check it out. 2 official languages, translation in over 200 languages. So very, very accessible. And if your language is not there, let us know and we will add it.
I'm glad we talked though about phone lines, because a lot of the seniors in my riding don't have cable. They have one landline. They don't have access to Wi-Fi, because it's not just about distance. It's also about, income. A lot of them can't afford it, and a lot of people can't afford to go online. And so the phone lines are important things to give them the support they need, that they can at least pick up a phone. And what we have done is we've resorted to snail mail and other ways of getting at our seniors so that they can know where they can go to get the kind of help. But thank you very much for that. And now we've got another question, and